Welcome back to Decode Healthcare with Harshal. Today, we're jumping right into part 10 of our Musculoskeletal Explainer series. We're breaking down the incredibly complex language of the CPT manual's 20,000 series, specifically focusing on the heavy-duty procedures of the pelvis and hip joint and translating all of it into simple, actionable coding knowledge. Let's get into it.
Here is our agenda for today. 1. Welcome to the lower body. 2. Pelvis versus hip joint. 3. Total hip replacement coding. 4. Coding hip and pelvis fractures. 5. Arthrodesis and major amputations. And 6. Our outro and next teaser.
Section 1. Welcome to the lower body. If you remember, Part 9 covered the highly intricate, delicate codes of the hand. Well, today we're shifting our focus completely downward to tackle the massive structural foundations of the lower body. We're looking at codes 26990 through 27299. Down here, the bones are thicker, the muscles are way denser, and the surgical procedures, they are seriously heavy-duty.
Section 2. Pelvis versus hip joint. Now, before we even look at a single CPT code, we have to make a very strict anatomical distinction. In plain English, think of the pelvis as a large bony bowl. Its job is to protect your lower organs and anchor your core. The hip joint, on the other hand, is specifically that mechanical ball and socket right where your leg actually attaches to that bowl.
When you look at the skeletal system, you can clearly see that massive central pelvic bowl made up of the ilium, ischium, and pubis bones. And right below it, notice how the top of the femur, which is the ball, fits absolutely perfectly into the side of the pelvis socket. That exact isolated connection point is the hip joint.
So, looking at our first chunk of codes for this region, incision and excision, spanning from 26990 to 27080, these cover your basic cutting and removal across both of those areas. This means a surgeon might be going in to drain a really deep, painful infection hidden under some very thick muscle, or they might be carving out a benign bone cyst right from the wing of the pelvis itself.
Section 3. Total hip replacement coding.
This brings us to a procedure you are going to see constantly in the field, arthroplasty, found in the 27097 to 27187 code range. The absolute crucial point here is understanding the why. When severe arthritis completely destroys that smooth, gliding cartilage surface of the ball and socket, the joint starts grinding bone on bone. The pain is agonizing, and it ultimately requires a total joint replacement.
The procedure itself is intense, but it's incredibly effective. First, the surgeon cuts off the diseased arthritic bone ball at the top of the femur. Next, they replace it by driving a metal or ceramic ball into the thigh bone. Then, they hollow out that diseased pelvis socket, and finally, they pop in a smooth, new artificial cup.
The hardware required for this is pretty extensive. You have a metal stem driven straight down into the shaft of the thigh bone, securely holding the new femoral head. And right above it, an artificial acetabular cup nestles perfectly into that reamed-out pelvis. So, when you see code 27130 for a total hip arthroplasty, this exact complex reconstruction is what's being coded.
Section 4. Coding hip and pelvis fractures. Next up, we have to talk about trauma. Fractures in this area are unfortunately incredibly common, especially in older adults. These codes span from 27197 to 27269. Your absolute golden rule here, location, location, location. The code changes entirely depending on whether the bone snapped high up at the femoral neck or slightly lower down in the intertrochanteric region. You also have to track the fixation type. Did the surgeon use internal fixation, or did they slide pins through the skin percutaneously?
To fix these severe breaks, surgeons obviously can't just use a simple cast. They use massive internal fixation devices. In an open treatment, a thick metal plate and a massive dynamic hip screw are run straight up through the bone, crossing the fracture line to hold that femoral head tightly in place while it heals. It's some serious hardware. And this brings up a crucial reminder for all of us. Accuracy matters above literally everything else here. If you mistakenly code a femoral neck repair when the surgeon actually fixed the shaft fracture lower down, your claim is going to bounce back instantly. You have to read the operative report meticulously to match the exact anatomy to the code.
Section 5. Arthrodesis and major amputations.
Let's transition to the final, somewhat more extreme procedures in this section. First is arthrodesis, covered by codes 27278 through 27286. Arthrodesis simply means surgical fusion. When a joint is too damaged to replace, surgeons will literally lock it in place. A prime example is fusing the sacroiliac or SI joint where the spine meets the pelvis. By using bone grafts or screws, the joint stops moving completely, which stops the pain.
Our manual outlines some highly specific guidelines here. For codes 27278 to 27280, there's a strict distinction between placing fusion devices percutaneously, meaning minimally invasive, right through the skin with image guidance, versus a traditional open joint fusion, where a large incision is made to physically pack in bone grafts. Then we have code 27290, the hemipelvectomy. This is a massive, life-altering surgery typically reserved for severe trauma or aggressive bone cancers. In this procedure, not only is the entire leg amputated, but a large portion of the bony pelvis bowl itself is completely removed. It is, without a doubt, one of the most extensive procedures in the entire musculoskeletal section.
Section 6. Outro and next teaser.
We've covered a tremendous amount of ground today, but the golden rule for mastering the 20,000 series is this. You've got to visualize the anatomy before you even glance at the codes. If you can clearly separate the bony bowl of the pelvis from the mechanical ball and socket of the hip in your mind's eye, your coding accuracy is going to skyrocket.
Structural knowledge really is coding power. Understanding how to translate massive physical skeletal repairs into just a few specific numbers on a page is a truly remarkable skill. But it does make you wonder, if distinguishing between a bony bowl and a socket is this critical, what other tiny anatomical nuances in the human body are completely altering the way a patient's healing journey gets documented? Think about that for a bit. And hey, make sure to subscribe to the channel because in part 11 of our Explainer series, we are moving even further down the leg to decode the femur and the knee joint. I'll see you there.